experts today who will guide us through their experience and real-world experiences. Thank you for being here. Let's make this an engaging and enriching session for all. Now, let's begin. So, I invite our chairpersons for the first session, Dr. Sushma Nigam ma'am, Dr. Vasanti ma'am, and Dr. Rajeshwik ma'am. Our first speaker for the session is Dr. Manisha Khare ma'am. CV. Please. CV play. Madam is organizing secretary for this prestigious IMS conference at Bhopal. Let's begin. CV mat dikhao.
Good afternoon, everybody. As the popular saying goes, don't judge a book by its cover. But here the cover is all that matters. As the cover, the skin is not only the window to the inner health, but also a predictor of several illnesses. So skin health matters, and more so as age each catches up. So I'll be introducing today's skin health workshop in midlife in women. Midlife in women marks a hormonally driven biological shift where skin aging, barrier failure, immune dysregulation, and systemic disease manifestations cover. Why midlife matters? Midlife, that is 40 to 60 years, is perimenopausal or postmenopausal transition. Major endocrine and metabolic shift occurs, especially the estrogen decline. Skin is a hormone-responsive organ and reflects systemic aging. It is often under-addressed in routine clinical practice. We talk about bone health, we talk about eyes, we talk about everything, but we don't really have skin workshops. Skin as a hormone-responsive organ, estrogen receptors are present, estrogen alpha and beta in epidermis, dermis, hair follicles, and sebaceous glands. Skin also responds to androgens, thyroid hormones, cortisol, and growth hormones. Estrogen plays central role in thickness, elasticity, hydration, and healing. The important thing in the postmenopausal age is that 30% of collagen loss occurs in the first year after menopause. Further, 1 to 2% loss occurs per year thereafter. Dermal thinning, reduced elasticity and vascularity occurs, which explains sudden acceleration of visible aging. And what are the common dermatological changes which are seen in midlife? They are lichen planus, lichen sclerosis, acne, rosacea, chronic urticaria, vitiligo, and also autoimmune bullous disease and vulvar dermatosis. And also the genitourinary syndrome of menopause. Skin is also a marker of systemic diseases because it is insulin resistance also is shown in the form of acanthosis nigricans. Skin tags are also a sign of insulin resistance. Then thyroid disease also, xerosis, the hair texture changes occur. Dyslipidemia is characterized by xanthelemia, CTD with cutaneous manifestations. So clinical implications are that skin changes are not merely cosmetic, but they are also clinically significant. Therefore, the need for routine screening in midlife women, early recognition of pre-malignant, autoimmune, and inflammatory dermatosis. What should be routinely screened? Xerosis and barrier dysfunction, pigmentary disorders and hair loss, vulvar dermatosis and pre-malignant lesions, autoimmune and inflammatory dermatosis. So the holistic management approach is to have lifestyle measures and photoprotection, appropriate skincare and medical therapy, address hormonal, metabolic, and immune factors, and also timely dermatological reference. So the take-home messages are that midlife skin changes are hormonally driven, and biologically they are very significant. Skin often serves as a marker of systemic disease. Proactive and preventive approach improves outcomes and quality of life. So the conclusion is that midlife is a critical turning point for skin health in women. structural degeneration, immune dysregulation, and photoaging coverage. Skin health should be an integral part of midlife women healthcare. So the message is that as we have all come together, let us explore not just treatments, but connections between mind and skin, gut and glow, hormones and health, because when we heal the inside, the outside shines naturally. Thank you, that's all.